Have you ever wondered why rheumatoid arthritis is often confused with other types of arthritis like osteoarthritis? What's really the difference and why does it matter? Hi, this is Dr. Ananta Subedi, your rheumatoid arthritis coach at the Room Doc. Today, we are diving into the key differences between rheumatoid arthritis and other form of arthritis. If you know someone struggling with rheumatoid arthritis or other form of arthritis, this video is for you. So let's break it down. Rheumatoid arthritis or RA is often confused with other forms of arthritis like osteoarthritis, but the two are fundamentally very different. Let's go over the key distinctions. First off, the cause. Rheumatoid arthritis is an autoimmune disease, which means your immune system mistakenly attacks your own body tissues, specifically the synovium of the joint, which is a thin layer of lining your joints. This results in inflammation and pain. On the other side, osteoarthritis is a degenerative process which is caused by breakdown of cartilage in the joints due to wear and tear over time. So while rheumatoid arthritis is driven by immune system, osteoarthritis is about mechanical wear or tear of your joint tissue. Now the next important difference is the symmetry. Rheumatoid arthritis typically affects joint on both sides of your body symmetrically. So if you have right wrist inflamed, your other side could also be inflamed and painful. In contrast, osteoarthritis typically affect one or two joints in an asymmetric fashion. For example, you might notice more pain in your right knee, but your left knee could be relatively unaffected. Asymmetry is a key feature in osteoarthritis. Another important distinction is the systemic impact. Rheumatoid arthritis is not just limited to your joints. It's a systemic disease, meaning it affects the whole body. Rheumatoid arthritis can cause inflammation that leads to complications like even lung diseases, heart disease, and even eye conditions. But osteoarthritis is mainly confined to your joints. It does not have any systemic complication. Now that we have covered the basics, let's talk about the joint themselves. A joint is where two or more bones meet together, allowing movement and providing support. To understand how rheumatoid arthritis works, you need to know the component of a joint. Bones provide the structure. Cartilage is the cushion in between the bones that reduce friction during movement. Synovium is the thin lining around the joint that produces synovial fluid, which lubricates the joint for easy movement. Synovial fluid is the slippery fluid that ensures smooth motion when you are moving your joints. And finally, the joint capsule is the fibrous layer that holds everything together. In rheumatoid arthritis, the immune system targets the thin lining called the synovium, which become inflamed and thickened. This inflammation leads to the production of excessive joint fluid and the disease progresses. The body also forms abnormal tissue called pannus, which is typically a thick layer of synovium. The pannus is a very invasive tissue. It invades the cartilage, the bone, leading to irreversible joint damage. This can result in pain and long-term deformity and reduce joint mobility if not treated on time. Over time, without treatment, RA can cause significant joint destruction and disability. But remember, rheumatoid arthritis is not just about your joints. Because it is a systemic disease, it affects multiple other organs, such as the lungs. Rheumatoid arthritis can lead to conditions like interstitial lung disease or ILD or pleurisy, which is a chest pain on deep breathing. Rheumatoid arthritis can also affect your heart. People with RA can have a higher risk of heart attacks, strokes, and inflammation around the heart lining called pericarditis. Rheumatoid arthritis can also affect your eye. RA can cause dry eyes, scleritis, which is inflammation in your eye, uveitis, which is inflammation on the inner lining of your eye. That's why early diagnosis and treatment of rheumatoid arthritis is so important. It is not just about reducing joint pain, it's about preventing these serious systemic complications. Let's quickly summarize the key takeaways from today's video. Number one, rheumatoid arthritis is an autoimmune disease and it causes chronic inflammation in the joints, which can lead to severe joint damage and systemic complications. Number two, the key to managing rheumatoid arthritis is early diagnosis and combination of treatment, lifestyle changes, and self-care strategies. I'm so excited to let you know that I have an upcoming book, The Holistic Rheumatoid Arthritis Guide. Take control, find relief, and thrive. Will be launching soon. It is a comprehensive guide to understanding and managing rheumatoid arthritis, and I cannot wait to share with you. It's packed with insights, tips, and strategy to help you take charge of your rheumatoid arthritis journey. If you found this video helpful, don't forget to like, subscribe, and share it with someone who might benefit from learning more about rheumatoid arthritis. This is Dr. Ananta Subedi, your rheumatoid arthritis coach here at the Room Doc. I'm here to support in your journey against rheumatoid arthritis. See you next time. Bye-bye. Take care of your health.